Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. Okay, this month's herbal profile is actually a category of herbs that help balance blood sugar, which is so important to our overall health. With me today is Dr. Patricia Gaines, who is the chair of the Botanical Medicine Department and a supervising physician at Sonoran University Medical Center. Dr. Gaines has quickly become one of my go-to herbal experts. But first, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione, clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, ProThrivers Wellness Brain, a product specifically for thrivers that contains cognizant for memory, focus, and attention, as well as other brain-supporting nutrients and herbs. You can find ProThrivers Wellness Brain online at pureformulas.com. There's also ProThrivers Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find ProThrivers Wellness Sleep at pureformulas.com. And Dr. Ohhira's Probiotics, it's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at DrOhhiraProbiotics.com. Dr. Gaines, thank you for joining me.
Well, it's a pleasure to be here. Thanks for having me.
Yes, it's such an important topic too. So before we identify some of the key herbs that we're going to be talking about to help balance blood sugar, why is it so important to have balanced blood sugar?
That's a great question. And I want to do a little explaining before I answer your question completely.
Okay.
So we function optimally when our blood sugar levels are in a normal range. For a non-diabetic person, that's around 70 to 100 milligrams per deciliter fasting. And after meals, it's less than 140. And when our blood sugars are too low, we usually feel it. We'll get hungry and jittery, maybe nauseous or panicky. But when our blood sugars are high, we don't feel it until they're really high. And so that's one reason it's important to go to the doctor's office and get regular blood work. Now, glucose can be measured a couple of different ways. You might have a glucometer, or you get it measured during screening blood work, or if you have a CGM, a continuous glucose monitor, you'll know what your glucose is. And there's a simple blood test called hemoglobin A1C, which is a great test, and it measures your average glucose over the past 3 months. It's better than just a snapshot of what your glucose is in one particular day. So what the A1C tests is the damage caused by high blood sugar, which is called advanced glycation end products. So the higher the hemoglobin A1C number is, the more damage you have from elevated blood sugars chronically. And an A1C of more than 6.5% is considered diabetes, or a fasting blood sugar greater than or equal to 126 milligrams per deciliter. There's also another measure that's really important and helpful, which is checking your HOMA-IR score. And that stands for Homeostatic Model Assessment of Insulin Resistance. You could go online and all you need to know is what your fasting glucose and fasting insulin is. You plug those numbers in, and if your number is greater than 2, then you're considered to have early insulin resistance at like close to 2, but higher than that, you are insulin resistant. Now, these two things in combination, high blood sugars or hyperglycemia and insulin resistance, set the stage for some chronic health issues. So to answer your question now, I would say that having those two conditions, high blood sugar and insulin resistance, leads to damage to blood vessels and nerves. It increases inflammation and oxidation and increases the risk substantially for coronary artery disease, heart attack, stroke, peripheral artery disease, kidney disease, peripheral neuropathy, retinopathy, fatty liver, dementia, Alzheimer's, cancer, and infections. And there isn't a cell that isn't affected by having diabetes. So a 1% drop in your hemoglobin A1C number is associated with a 21% decreased risk of complications from diabetes. So to answer your question now, for long-term health, it is critical that we maintain healthy blood sugar levels.
Yeah, absolutely. I mean, you've mentioned the heart, the kidney, the liver, the brain. I mean, these are all things that are major factors when it comes to our health. And we know that it also can increase risk of certain cancers as well, this insulin resistance that you're talking about. So, okay, let's talk a little science before we talk about specific herbs. How do herbs work to help balance blood sugar? Take us through some of the key mechanisms of action.
Well, I will say that there's a lot of crossover between food and herbs. And before I get into the mechanism of plants, there's so much crossover. I did want to put a plug in for using food as medicine and eating a diet high in antioxidants and high in fiber, especially soluble fiber, is really helpful to help normalize blood sugar. Also, generally lowering the carbohydrate intake in the diet, like eliminating simple sugars and shifting the diet more towards a high protein and non-starchy vegetable diet with healthy fats is considered a more favorable diet to support blood sugars in general. Now, there are multiple constituents in plants that have blood sugar regulating properties, including polyphenols, flavonoids, alkaloids, and terpenoids. And there are many mechanisms for decreasing blood sugar, including protecting the pancreatic beta cells, which are the specific cells that produce insulin, decreasing oxidative stress and inflammation, inhibiting enzymes that break down carbohydrates into simple sugar units, such as alpha glucosidase inhibition, improving insulin resistance, decreasing the liver's production of glucose, because the liver can produce glucose too, and activating AMPK, which is a cellular master regulator of glucose and lipid metabolism. So that's just kind of a start. There are so many mechanisms for how herbs can work with the body to improve blood sugar control.
Yeah, it's really quite cool. And one thing that we didn't mention when we were talking about conditions is maintaining normal body weight. And it strikes me that these GLP-1s for weight loss, their primary mechanism is they suppress the appetite, they increase this feeling of fullness, and these drugs began as diabetes drugs.
Right.
So can you take us through a little bit about the GLP-1s and like how that relates to controlling blood sugar?
Right. Well, those GLP-1 agonist medications are really powerful at, like you said, decreasing food noise, which is that constant thinking and ruminating about eating and snacking behavior, which can certainly lead to weight gain. They can help with satiety or a feeling of satisfaction so that you're not so hungry. And they're really powerful at lowering blood sugar and helping with losing weight. And when a patient has weight so high that it really is creating risk factors for major health issues, then those can be helpful tools while you're working on other things like maintaining a healthy diet and getting behaviors to exercise and making sure you're eating enough protein and working on building muscle mass. Like all those things go together, and those habits should really be in place for best maintenance of weight loss, because once a patient gets off those GLP-1 agonists, they certainly don't want to be gaining that weight back if possible.
Right. And we know that the GLP-1s do have side effects. And that's one of the reasons why we wanted to talk about herbs as it relates to balanced blood sugar. So the first thing I'd like to have you do is give me your go-to herbs, your list, a short list of go-to herbs for blood sugar balance. And then I want to talk about each of those.
Okay. Yeah. So I don't know how many we'll have time to get through. So Well, my list would include berberine, which actually isn't a plant, but it's a compound found in a couple plants like golden seal, barberry, and Oregon grapefruit. So we can talk about that. I would add in there cinnamon, Gymnema sylvester, which has a common name of sugar destroyer, and it's not a native plant to the US, but it's used commonly to help with sugar cravings and decreasing appetite and lowering blood sugars. There's prickly pear cactus pad and bitter melon.
Okay, prickly. I'm just writing down some notes. I am actually glad that you started with berberine. So I want to start there because there was a time when berberine was called nature's Ozempic, which was really a misnomer, and I think that that was more hype than anything. However, the research regarding berberine is pretty fascinating, not just with blood sugar control, but also cholesterol and weight loss. So tell us a little bit more about berberine.
Yeah, so there's a lot of research on berberine, which is part of why it made my list. It's technically an isoquinoline alkaloid, which, like I said, is a constituent found in a variety of plants. It's a very bitter compound, and it's used for a bunch of other conditions as well, like GI infections, GI inflammation, topical skin issues, and for lipids, hyperlipidemia.
Mm-hmm.
It decreases fasting blood sugar about 9 to 15 milligrams per deciliter, decreases hemoglobin A1C about 0.5 to 0.73%. It decreases it decreases production of sugar from the liver, and it improves insulin resistance. So it does a bunch of different things to really benefit supporting, improving insulin resistance and lowering blood sugars. And in trials, there's a small decrease in body weight, about 2 to 5 pounds. So you can't really compare that exactly to GLP-1 agonists, although studies show that berberine has comparable effectiveness at lowering blood sugars in type 2 diabetes compared to metformin. And berberine actually is better than the other conventional medications like GLP-1s and metformin for improving lipids. So that's one benefit that the other medications don't really have. And then, like you said, there's a lot of side effects potentially to those conventional medications where berberine's very safe. What I would say is that it's really bitter, and so sometimes it causes some nausea or GI upset or diarrhea, but that's really the only major side effect. And typical dose is 500 milligrams 3 times a day with a meal.
Okay, perfect. I'm glad you mentioned the dose because I was going to mention that. So let's go next to cinnamon. And it's so interesting because I think cinnamon has gotten a lot of publicity, and people will say, oh, I put cinnamon in my coffee and I put cinnamon in my food. And I think the one thing about some of these herbs, especially cinnamon, which is a powerful spice, can you get enough through diet alone, or does it require a dietary supplement?
Well, I will say that adding like a little cinnamon to a super sweet coffee drink is not going to be good strategy for managing your blood sugar.
Right.
I think you really do need to supplement cinnamon other than just sprinkling it as a spice. And so in terms of cinnamon, there's a couple different varieties, and the bulk of the research has been done on cassia cinnamon, which is Chinese cinnamon. The inner bark is the part that's used, and of course, most people know it as a spice and flavoring agent. It's generally thought of as an insulin sensitizer, and it's been shown to lower postprandial glucose absorption, enhance cellular glucose uptake, improve glucose metabolism and glycogen synthesis, and inhibit the liver to produce sugar. It does stimulate insulin release, and it enhances insulin signaling and receptor activity. So it does a bunch of things that are really beneficial to help improve insulin resistance and lower blood sugars. And it reduces CRP, which is a marker for inflammation, and lowers lipids. So there's a bunch of things that are really cool about using cinnamon.
Yeah, and what's the dose of cinnamon?
Cinnamon's usually dosed at 500 milligrams to 1 gram, either before or during a meal.
And here's the interesting thing, Dr. Gaines. You've only gone through 2 of
I
the
know.
herbs. And you've already both of these herbs have multiple mechanisms of action, and not even mechanisms of action. They have multiple benefits. So this is not just a one-trick pony when we're talking about these herbs. These have multiple benefits. So I'm curious if Gymnema has the same profile, like multiple ways that it helps. So take us through that one.
Okay. And that's obviously the benefit of herbs is they have lots of constituents that work different ways in the body. So the mechanism usually isn't binding to one receptor and having one particular action. So Gymnema is native to central and southern India and tropical areas. The leaf is the part used, and it has a really interesting action that when in contact with the tongue, it contains compounds that actually block the taste of sweet on the taste buds. So for instance, if you took a tincture of Gymnema and swished it in your mouth for like 30 seconds and then swallowed it, what you'd notice is that eating anything sweet after that doesn't taste sweet. So it takes away the reward for eating sweets and helps to curb sweet cravings. That's one way it works. But also when taken internally, it increases secretion of insulin from the pancreatic beta cells, and increased insulin results in decreasing blood sugars, and it also inhibits glucose absorption from the intestine and inhibits hepatic gluconeogenesis. Now, I do want to say about Gymnema that action of stimulating the pancreatic cells to release more insulin is called insulin secretagogue action. And I don't want that to be the major action I use when treating patients. Sure, it helps lower blood sugars, but usually I'll use Gymnema as just part of a formula with other herbs that are doing other things.
It's interesting because I was going to ask if there's synergy between any of these and if you do use them or if you use them in isolation or solo.
I do like to use them in combination, although sometimes I use berberine by itself, but most of the products for blood sugar you'd buy like at the health food store probably are going to be combination products, or you can buy berberine by itself. But when I have patients with really intense sugar cravings, I will give them a tincture of Gymnema kind of as a tool to have in their pocket when their sugar cravings get really intense, and they can just squirt like a dropper full or two in their mouth and swish it and swallow. Yeah. And that really does help with the cravings.
Yeah, that's cool. Okay, the next one is prickly pear. And I'll tell you, I don't know as much about prickly pear as it relates to controlling blood sugar. So take us through prickly pear.
Prickly pear is interesting. And it's that perfect crossover is food as medicine because it's a botanical, but it's also a food. It's a flowering plant in the cactus family that grows in portions of the Western and Southern US and Mexico, and it's traditionally been used to help manage blood sugars. The pads are called nopales, and that's the part of the plant you'd use for this. And that you'd probably recognize if you saw pictures of prickly pear cactus that the pads are really distinctive looking. And research that shows that in type 2 diabetics eating a high carbohydrate meal, adding nopales led to significantly lower glucose rise and glucose duration compared to eating the same meal without the prickly pear pads. So one reason is thought that these are really high in fiber and mucilage, and it forms a gel in the GI tract, which slows down gastric emptying and slows the absorption of carbohydrate. And by doing those things, it really is blunting the blood sugar spike after meals. So studies usually use 1 to 2 medium-sized pads, and they can be chopped and stir-fried, they can be broiled, they can be boiled. And I would say eat those with a higher carbohydrate meal, and that can be really beneficial.
Interesting. But now here again, you would have to eat nopales almost every day in order to get the therapeutic benefit.
That is true. And a couple things is I live in Arizona, so the local stores have this because it's local and it may not be available in your area. So maybe this isn't the one for you. You do have to eat it to get the benefit long term. But there's a lot, and we're just naming a couple. There are a lot of herbs because there's traditionally diabetes was used it was managed with botanical medicine. We didn't have these medications. So every culture has herbs that grow in their region that they've used for this.
Yeah. Okay, bitter melon. Tell us about bitter melon.
Bitter melon. Bitter melon is a tropical member of the cucumber family, and it kind of looks like a knobby cucumber. It's cultivated in places like South America, East Africa, Asia, and India, and it's traditionally used to treat diabetes. It does have a very bitter taste, and so in some cultures where it grows, it's tradition to make meals using bitter melon. Some of its mechanisms are it inhibits alpha glucosidase, and that's the enzyme that breaks down carbohydrates into sugar units. So it slows down carbohydrate metabolism and decreases blood sugar spikes after meals. It decreases hepatic glucose output. So it decreases the amount of glucose that the liver produces. It enhances uptake of glucose into skeletal muscles and has a protective effect on pancreatic beta cells. So all of these things really support good glucose management. What I will say about bitter melon is that that moniker is true. It is really bitter. And so if this is not a traditional food for you, it's probably not something you're going to juice or start using in terms of meal preparation. But if it's traditional for you and you like it, go for it, consume it. You can juice it or you can eat it as a food, but it may be combined into a combination product for blood sugar. So usually those combo products have a combination of many of the herbs we've talked about. And bitter melon may very well be one of those.
That's what I was thinking, is that bitter melon and maybe even prickly pear, I'm not sure, it would be more of a combo ingredient in a blood sugar formulation, whereas I do see berberine just like on its own.
Right.
That's a pretty fair statement then, huh?
Absolutely. And then oftentimes these herbs are combined with things like chromium or other nutrients that aid in blood sugar management too.
Yeah, and appetite control and other things. So, okay, let's talk a little bit about safety. We're just talking about the ones that you mentioned, and if you want to talk about the whole category, you're welcome to. But how safe are these herbs for blood sugar that we've been talking about, or the other ones in your toolbox? Are there any contraindications, adverse effects, or people who should not take these herbs?
Sure. Well, the herbs we talked about are very safe based on this really long tradition of using herbal medicine for blood sugar management. The major issue has to do with additive effects, meaning that if you are pre-diabetic or diabetic and you're already on medications to lower your blood sugar, and then you add in herbs that also lower your blood sugar, you really need to check to make sure your levels are safe and that you're not over medicating. So likely there will need to be an adjustment to your medication. And of course, that's a good thing to have your blood sugars in a good range, but the dose of medication should be appropriate. You don't want to overshoot it. Like, don't check, start adding in these herbs, and then all of a sudden your blood sugar ends up being low. In general, I'd say some of these herbs probably better to not be taking during pregnancy because there's usually a lack of adequate research to determine safety that way. And like I said, the berberine, although also bitter melon, are really bitter and they can cause some nausea and GI upset.
Mm-hmm. Okay, so before I let you go, overall, what final advice do you have for people who want to use herbs to help balance blood sugar?
Great question. I first would say start by knowing what your blood sugar levels are. These are really easy blood tests. Find out what your glucose is, your insulin, and your hemoglobin A1C. And then if you're not taking medications to lower your blood sugar, I think it's really safe to add in berberine or another blood sugar regulating herb and see how that impacts your levels. Give it about 3 months and then recheck. Now, if you already have a diabetic diagnosis and you're on hypoglycemic medication or or you're pre-diabetic and on medication, then you should be using some kind of a device. And so you can know what the impact is immediately of changing your diet or adding in herbs. But I will say there is so much that patients can do, not just with herbs, but with changing your diet, starting to move, managing your stress, getting good sleep, how you sequence your meals so you're eating carbohydrate last when you're eating a meal. All these things can really help lower your blood sugar. So don't feel like there's nothing you can do other than just conventional medication, because I feel like these herbs can be super helpful.
Yeah, that's what I like about your approach. You understand the science, you know the science, and you're very pro herbs. But first and foremost, you are food first, diet, lifestyle, building that foundation, and then utilizing the herbs to help enhance that strategy. I think that's really smart, and I think that's very holistic and integrative, and I think that's what people need when it comes to balancing their blood sugar.
Absolutely. And in the case of blood sugar, I will say that diet plays such a central role that herbs by themselves are not going to have a ginormous impact. All of this has to go together with diet, exercise, and sure, the herbs can certainly help too.
Yeah, I agree. Well, thank you again, Dr. Gaines, for joining me to talk about this important category of herbs. I'm looking forward to the next time we get together and talk botanicals.
Well, my pleasure.
All right. Well, once again, I'd like to thank our sponsors, ProThrivers Wellness Sleep, ProThrivers Wellness Brain, Cetria Glutathione, the superior glutathione to support liver and immune health, and Dr. O'Hara's award-winning shelf-stable probiotic. Thanks for listening, and remember, you can find past shows at ithriveplan.com or wherever you listen to your favorite podcast. We are on every major podcast outlet, and or go to ithriveplan.com. So may you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.